Hello viewers, how are you doing? My name is Mary. Welcome to Health Facts on UBC TV Inspiring Uganda. Tonight we are going to discuss about breast cancer. In case you didn't know, October is dedicated for breast cancer awareness, and that's what we're focusing on tonight. With me on the show, I have Dr. Joseph Turyabahika, a senior surgeon working with Kampala Medical Chambers, and he's here to teach you about breast cancer. So stay tuned. If you want to get in touch with us, it's very simple. Go on our Facebook page, which is Health Facts on UBC TV. Like the page, ask any questions, and we'll be glad to answer all of your questions. Dr. Joseph, welcome to Health Facts.
Thank you.
So before we waste any time, this October is dedicated for cancer awareness or breast cancer awareness. To you as a senior surgeon, what is breast cancer?
Breast cancer is when a breast cell has decided to multiply, spread and affect other parts of the breast.
Okay.
And it can cause a lot of problems to the human being.
Doctor, you just explained what breast cancer is. Does it have types?
Breast cancer has so many types.
Okay.
And there are so many types, and it can also start as a lump in the breast. You can have a nipple discharge, which is bloody. You can have pain. Basically, there are many presentations, but the commonest one is when it is late and you see mass lumps, breast lumps, sometimes ulcers on the breast.
Does breast cancer affect one breast, or it actually also goes to both breasts?
As I have said before, it can affect one breast only. It can also start simultaneously on both sides of the breast.
Okay.
And that type, we know it is lobular carcinoma.
And is it that common?
It is common also,
Okay.
but we also have one which is called ductal carcinoma, which can stay on one side of the breast.
Okay.
But we also have other types which can involve the whole breast. For example, if you have an inflammatory type of a breast cancer.
Okay.
And we also have breast cancer which can come from somewhere and come as a metastasis. In other words, it becomes a deposit from another area.
Like what area exactly?
The breast has parts.
Okay.
Actually, it has quadrants. And it also have a nipple and a dark area around the nipple, which is called areola.
Okay.
So there are also diseases of the nipple which can progressively affect the breast, and inside the breast you may have cancer like Paget's disease of the nipple. You can have eczema. You know, there are other telltale signs of cancer of the breast.
Okay.
And basically, sometimes the breast cancer is silent. You may not know, but you may discover a lump in your breast accidentally, or you may have a breast pain, just pain. Then you may have a nipple discharge, which is bloody, just bloody discharge. Then you can also have just one side of your breast bigger.
Okay. The size.
The size bigger. Would also have a different color.
What kind of color? What kind of color?
A darker.
Wow. Okay.
Yeah, it could also be a retracted nipple. The nipple can go in backwards. There's what we call pidorange, like the skin of an orange. If you can imagine the skin of an orange or a lemon. Okay. If your breast looks like that, then we know there's problems.
You're not safe.
You are not safe.
Okay.
Then there's when it is swollen and hot and painful. All those are signs telling that something is going wrong in the breast.
You need to see a doctor.
You need to see a doctor.
Doctor, what do statistics say about breast cancer here in Uganda?
Breast cancer is becoming common.
Okay.
And when you look at the figures that come into the National Cancer Registry, that the people who come to Murago come in late. Okay. And unfortunately, most of them come when they have advanced disease. If we look at about 100 patients who come to Murago with cancer of the breast, The 5-year survival rate may put to about 43%. In other words, 57 person within the 5 years, whether they're on treatment or not, because basically the disease is late, is diagnosed late. And it would be much better if they could come early, and we offer the best. Because we know very well that if somebody who has cancer of the breast reports early, then the treatment is put in place very early, and then the survival rate is good.
Okay. That has brought me to my next question. Who is at risk of getting breast cancer? Am I at risk really? Because I don't feel anything bothering me. Yeah,
ideally every woman and man is at risk, but there are predisposing factors. Advanced age or increasing age. In other words, all cancers world over, once you above 45 and above, you are at high risk. Specifically for cancer of the breast, we know very well that if you are coming from a family where you lost a sister to cancer of the breast, your mom, your next of kin or close relatives, you are at high risk. Mothers who give birth and do not breastfeed their babies for 1 or 2 reasons, they are also at high risk. In other words, the best way is to have the baby breastfeed. Okay? And that has a protective effect on the breast. Then we also know that obesity and alcohol, they are also predisposing factors to cancer of the breast. Of course, there are others who fall into a family cancer syndrome where they have a gene, and that gene is scientific. It's BRCA1 and 2. It's a gene. Once they find it in a lady, then you are likely to have develop cancer of the breast. As much as cancers are common in women, also men also have a high chance of cancer of the breast. And for us, it is actually very aggressive. When it comes, it's sometimes not expected, and we tend also to ignore it. We think it's just a lump. But when it comes in full swing, and it's a killer. So men also should be on the watch out for breast cancer. Despite cancer of the breast, generally there are other cancers which also affect everyone. Male especially, we have cancer of the prostate, which we should also consider seriously. So screening for prostate cancer should be mandatory also, above 35. 35 to 40 and above, we should also screen for prostate cancer. Then the ladies, of course, cancer of the cervix is also there. Colorectal cancer, cancer of the colon, lung cancer because of smoking, which we talked about. And also we have leukemias, which are so common now these days. So all that is a group of cancer that affect all of us. But specifically, since this month is for breast cancer world over, we need to emphasize that ladies should come for breast screening. And there are many ways of doing it. Screening can start at home in your bedroom. You relax yourself. You look at yourself in a mirror. You look at your breast, whether they are equal, whether one is bigger than the other, whether they have changes, which I talked about.
Orange color.
Then you start with your hand straight, a palm. And you can choose to do the left breast or the right breast. Basically, you palpate, you examine, you feel for any lumps. You move in an order. You can decide to go clockwise or anti-clockwise until you finish. And when you finish with the whole breast, remember to put your hand into the armpit, the axilla. Because there, cancer can spread to the axilla. So you check if there are any lymph nodes there. Then after finishing that side, you do the next one. Because as I said, cancer can start in both breasts at the same time, or it can be in one side and spread to the other. So once you have any doubt that your breast is not okay, it is advisable to seek medical attention, to go for the nearest clinic or nearest health worker who will again examine you and tell you what to do. If you can't, then you move on to the next stage. And there are many hospitals where you can go and you have the breast examined. Actually, most hospitals run breast clinics these days. And they have specific days. They do screen breast, they screen cancer of the breast, and they also do cervical cancer screening at the same time. So it is better for the working class to have time to go and have a check. Even those who are not working should report to the nearest place. In other words, it's advisable that you should start be aware or examine yourself at 20 years.
Okay.
Yeah, because that's basically where things can start going wrong. Having lumps, ignore them. Breast pain, you ignore. Discharge, you ignore. Itching, you ignore. At the end of the day, you come when it is too late and the doctors can't help you. The only thing they can offer you is palliative. In other words, removing what is already too late.
If I am not satisfied, are there other means or other tests you run to detect the same problem?
Yeah, correct. That's right. You know, different women have different sizes of the breast and we have different bodies.
Okay.
Sometimes the breast may be too big that even you feel nothing basically when you examine.
Okay.
And at the same time, you may have a smaller breast where you can really examine very well. Now, for people who are not sure, there are tests we do. One of it is breast ultrasound.
Okay.
You go to a hospital or a clinic and they do a breast ultrasound. And if that's maybe not satisfactory, we go to what we call a mammogram.
Okay.
And that one precisely can show us if you have hidden lumps there or if there are calcifications, small things which are hidden. In other words, it's an X-ray of the breast, soft tissue of the breast, which can show different things which are happening. Blood vessels, lumps, you know, the whole architecture of the breast is shown on a mammogram. And we can tell from a professional point of view that there is something wrong. Okay? Now, if we take it further and there is a lump, then we should go for a biopsy. Take a small part of it and send it for a laboratory examination to confirm that there is cancer or no cancer.
Okay.
But one thing is very clear, is that people should not be so scared. If you feel a lump, sometimes it's not cancerous, just a simple lump, which you can just remove, and you don't have cancer.
Okay.
So it's not that all lumps are cancerous. Actually, most lumps are not cancerous. Some are fibroadenomas, meaning that they are just growth, just lumps because of the hormone stimulating the breast. The way you heal fibroids in the uterus, they can also develop lumps in the breast, which are not necessarily cancer. However, to tell the difference, we have only to first remove it and check it.
Okay.
So it's not advisable for ladies to keep lumps, breasts with lumps, and you ignore. You never know which one changes into a cancer.
So doctor, if I've been unfortunate enough and I test positive, I have breast cancer, what is my way forward?
So if it's unfortunate that you have cancer of the breast and it has been confirmed, the first step is to really relax, because we have different options. And definitely you need counseling to begin with. Yes. Because you can decide to be depressed, drop dead, you know, all sorts of things can happen. So we normally stage that cancer of the breast.
Okay.
If the stage 1, very early cancer of the breast or advanced cancer of the breast, your personal doctor should be able to discuss with you what stage you have. Now, if it is unfortunate, it's very advanced, then definitely what we are going to do will be basically palliative surgery. In other words, we will make sure we treat the symptoms so that you have a better living. We improve the quality of living. Because remember, some of these cancers, they have spread if it is advanced. They are likely to spread to the chest. You have chest pain, you have cough. They can go to other parts of the body. If it is very advanced, the cancer may be having also a wound, which is bleeding. And sometimes the wound can be infected. It is rotting. So it depends on what stage really the cancer you have come with. But if it is another stage of cancer of the breast, there's a lot of hope.
Okay.
There's a very good hope. Doctors will normally classify it. If it is very, very, very early, we do many things to make sure it does not progress.
Okay.
We take youth theater, definitely we can decide to remove the whole breast, or we can do what we call an extended quadrantectomy. The breast has parts, it has quadrants. We can decide to do an extensive surgery on that breast, because these days we encourage breast preservation. We don't encourage whole breast removal. But when we are doing it, we have to be careful to make sure that you have left no breast cancer behind. And then you go ahead, you give treatment. Definitely, in the screening or in the investigations, we have known whether this cancer is responsive to hormones or not. In other words, once you have removed the cancer, you have to go and check whether this tissue or the breast cancer itself is responding to estrogen or progesterone. These are hormones in women. Then the treatment will also depend whether the cancer has receptors for estrogen or progesterone. So after removing the whole breast of the breast tissue, then you can subject the lady to treatment, chemotherapy, which is offered at Mulago Cancer Institute. And also, depending on the hormone responsiveness, you can give anti-estrogen. The drugs are called tamoxifen. There are many, and they are newer on the market. So basically, if you have early cancer, we expect good results. Very good results. Can be managed very well. And in my experience, actually, I've done quite many, and they are still surviving, and they are happy.
Doctor, what do you do with someone who has come at an advanced level?
There are many treatment options we have when somebody has come with an advanced cancer of the breast. We may decide just to do a small tissue biopsy on that part and really confirm using histology to know that this is real cancer. And from there, we can decide to first send you for radiotherapy to shrink the tumor to make sure that it's reduced. And people at the Cancer Institute or radiotherapy, they can give you also doses of radiotherapy. And then when the cancer has really shrunk, then we can send you back to us, and we do what we call palliative surgery. In other words, we take off the bulk, the remaining part of the cancer, and then we again send you back for further treatment. Of course, there are some cancers which are very aggressive, which can really take a short time, and there are those which are slow growing, which can really take a long time. So it all depends, but there are certain things we look at when we are looking at the tumor biology of that cancer, and one of it is the age. Usually, majority of these tumors, sometimes they are hormone dependent. And they can decide to be aggressive. And that's where, as I had mentioned earlier, where we use some other drugs like tamoxifen or so forth. Then also, maybe before we look at the treatment, we look at if this person the lady is menopausal or premenopausal or postmenopausal. If you are postmenopausal, then the treatment changes. If you are premenopausal, the treatment is also slightly different. So all in all, it is an assessment by the doctors, and they give treatment according to what is
the
stage and the age, whether menopause or postmenopausal, or whether there is receptor sensitivity, estrogen receptor or progesterone receptor. So it depends. It is really basically individualized, depending on the circumstances of that biology of that tumor. Maybe there are other risk factors maybe which we not have said at the beginning. If you get your menopause late, you are becoming a menopause at 51. That means you are still, hormones are still active. Or when you start your menarche, your periods very early. That means you have a longer period of hormones in you.
Early, like how old?
Below 13 years. If, for example, you start your periods at 9 years. So that means you have started your womanhood very early. Therefore, your breasts are going to be subject to hormones for quite a long time. Because these tumors, most of them, as I've said, are hormone. They respond to hormones. They are basically hormone provoked. Yeah.
So, doctor, how can I reduce the risks of having breast cancer?
You have asked a very good question. How can you reduce the risks?
Yes.
One of it is regular exercises.
Okay.
Exercises, very good. The second one is take a balanced diet. Fruits, vegetables. The balanced diet the way you know it. The second one is to avoid alcohol intake. Because alcohol and smoking, as you know, increases all cancers, including breast cancer. The next one is to avoid being fat, overweight, obesity, because it also increases the risk by itself. Now, there is another group of women whom we have to inform. Those whose relatives died of breast cancer, to be aware that they should avoid using pills, because they also have that increased risk. If you lost a sister, you must avoid estrogens or progesterone pills. You have to use other alternative means of family planning. Okay? That one is very, very important, that those mothers or ladies who have lost relatives to cancer, they should definitely not include a risk to themselves by taking pills, contraceptives.
Okay.
They should use other alternative means. Okay?
Okay.
The other sure way is to have a mother breastfeeding her babies.
Okay.
Because that is now becoming a habit. Ugandans, when they have jobs and they have given birth to their babies, they don't want to breastfeed. They want to keep tight breasts. They don't want breasts which are breastfed and they look funny. So in order for you to avoid breast cancer and you have a baby or babies, make sure you breastfeed as long as possible. Because if you don't breastfeed, the hormones continue stimulating that breast. You end up with lumps and you end up with cancer. So it is very, very, very important that mothers really do breastfeed. In case you are a working person and not able to be at home breastfeeding, the best thing is to use breast pumps.
Okay.
You do it, you leave breast milk behind, and when you come from work, you breastfeed. Even at night, every time you make sure your breast is breastfed, so that you don't have a high risk of cancer of the breast. I think basically those are the ones which I think are very clear and they are practical. Then the other thing is, of course, to come for medical checkup at any stage. And this includes men and women at the same time, because we are all prone to cancer of the breast, although the women have a more chance of cancer of the breast than men.
In your final remarks, what advice do you give to Ugandans about breast cancer?
Thank you very much. The final remarks or the advice I give to fellow Ugandans is that breast cancer is now real, and we must, as Ugandans, be aware that it is here and it is here to stay. The only thing we should do is to check our breasts regularly, and if you suspect or you are not sure, you go to a nearest health unit or a nearest clinical hospital.
Okay.
And then the other one is to eat well, a balanced diet, and we should avoid junk foods because they have become too much in Uganda now. And the other one is to basically encourage all women from 20 years to seek medical advice and to do breast self-examination. It's very important because most people may not have any symptoms of breast cancer. So it is encouraged that everyone should do a breast self-examination in his or her room. So that if there's anything wrong, you go and seek medical advice. Because cancer of the breast is a killer. And once it has happened, it shatters the home, the family. You leave children, you leave husband, and you are no more. So fellow Ugandans, please, it's better, it's high time to go for breast cancer screening. And it doesn't mean that you have to go specifically for breast cancer. You may be going to visit a hospital for some other reasons, but ask your doctor or a nurse that can I also have a breast check, they will do it. And it is offered free. It is offered free. So please utilize the services.
Thank you very much for being on
You're
Health
welcome.
Facts. I'm looking forward to hosting you again.
Thank you so much.
Okay, good night.
You're welcome.
This October is dedicated to cancer awareness, rather breast cancer awareness. Most hospitals actually in Uganda are offering free breast cancer screening. So go out and check for these hospitals. Tonight on the show, I had Dr. Joseph Turyabahika, a senior surgeon at Kampala Medical Chambers Hospital, and he explained to you the risk factors of breast cancer. I think you had or you learned a lot from this show. I've been your host, Mary. Until next time, have a very good night. Don't forget to go on our Facebook page, which is Health Facts on UBC TV, or on our YouTube account, which is Health Facts on UBC TV. Have a very good night.